Our North Dakota Department of Health has been staffing its Emergency Operations Center since January when we first heard about this. So we've been operating for over 2 months. Today, we're going to be expanding that operation with members of our Unified Command, which includes North Dakota Department of Emergency Services, North Dakota National Guard. We have our Adjutant General, General Alan Dorman, here with us today as part of this. They have been part of these meetings prior, but we're going to work in even more tighter and broader fashion at the point. But today was kind of the day that we've been preparing for 2 months, was the day in which we had our first positive case. As we look at measures to protect North Dakotans, we really want to focus our resources, and it's important that we focus our efforts especially on those that are elderly or those with chronic health conditions such as heart or lung disease. We also have to remember that there are some special needs children with chronic conditions, so we can't forget about our kids. But as we've said at earlier meetings, the early data on this has got one bright spot, which is that relative to the flu, infants, children, and young adults appear to be less at risk from mortality from coronavirus than they do from the regular flu. As a matter of fact, 2 days ago, when we were on one of our federal calls, it indicated that there were no cases had been confirmed of anybody under age 9, and there had only been one mortality of someone under age 18, and that was a young individual who had cystic fibrosis, which you know is if untreated, a terminal disease with an average life expectancy of about age 30. So this is hitting elderly people more than it's hitting youngers, and in that sense, we have to really pay attention to what we're doing. We have 80 skilled nursing facilities in the state of North Dakota. Last night, we had a meeting with the health department. We've had calls, 2 calls earlier this week with statewide calls with dial-in to meet with all the leaders from those skilled nursing facilities and assisted living facilities. We've been working with the North Dakota Long-Term Care Association, North Dakota Hospital Association. There are a set of protocols that have been adopted by the national organizations for long-term care and skilled nursing, and those agencies or those organizations in North Dakota intend to adopt those, and we're going to be working as a state to ensure that those protocols are adopted, and a lot of those protocols relate to visitation at these facilities. The key would be to make sure to protect the elderly as we keep the virus from getting into those facilities, and we do that through strong screening and strong policies in terms of who can visit and can't. So nationwide, the response has evolved, really more towards mitigation, because the key to slowing, if we can slow the rate of spread of this disease, that takes pressure off of our community health organizations, off of our hospitals, off of all the people that are providing services to support people that have become sick. And so again, because there's no quote cure for COVID-19, if you stop the spread, you think of it as a curve. There's always math involved in these epidemics, and if it spreads rapidly and a lot of people get sick in a short period of time, then that can put enormous pressure on our healthcare system. If the exact same number of people actually end up getting sick, but it occurs, over 3 months instead of 3 weeks, you take that peak out, and then that allows us to make sure that we have the ability to serve through our healthcare system those people, and we should then have better outcomes for the people that we're serving. So part of the strategies that we're deploying here are trying to avoid a rapid spread, which would create a steep peak, and we have to kind of spread this out over time. The lab here in North Dakota, the Department of Health, is working on increasing their testing capacity. We know that in other places in the world, such as Korea, they've gone to drive-by testing, which would mean then an individual who may suspect that they don't have may suspect that they've got symptoms actually don't even have to get out of their car. The people that are administering the tests, we don't end up infecting medical facilities. So we're taking a look at all the best practices on how we can increase testing. But right now, people with mild symptoms should just self-isolate. If you want to have contact with your health provider, give them a phone call as opposed to walk in. And only those individuals with severe symptoms should go in, but you should always call before you go in. We do not want people just showing up at emergency rooms saying, I think I've got the coronavirus, because we would want those emergency rooms to be able to prepare to receive you before you come in. So call before you come in, and if your symptoms are mild, then step one is just self-isolate at home. As we know, there are antivirals that exist in the marketplace under brand names like, Tamiflu and others, for when you have the flu. And we know the flu season is still going on in North Dakota, and you can get tested. There are people that get tested. They've got influenza A, but there are no antivirals for COVID-19. These are things that would help address the symptoms. So the best course of action is just stay at home, drink lots of water, wash your hands often, and avoid contact, particularly with those people that might be more vulnerable to either the flu or to the coronavirus. And again, all of these are goals, as we say, is to flatten that curve, distribute the impact over as long a period as possible so we don't overwhelm our healthcare resources. Yesterday, the CDC released a 4-part framework for community mitigation that relates to how we can prevent and slow the spread of the disease in workplaces, schools, homes, and commercial establishments. And so we're going to be continuing to distribute those out to folks. And again, as we think about those that are most vulnerable, if you're at very low risk, if you're a healthy individual, but we need to think about those, whether it's parents, grandparents, coworkers, neighbors, or others, is who we've got to be thinking about right now. We know in North Dakota that one of the things that makes it great to be in the state is that people care about each other, and often that caring has been, if there's a crisis or a situation, part of what we do is, everybody comes over with a hot dish. Everybody knocks on the door and says, what can we do and how can we help? And we have to maintain our ability to be to this great caring state that we are, where we've always had deep concern about our neighbors. We got a great sense of community, but how we think about our actions now, we've got to think before we act, because in some cases it might be better to call that neighbor versus just drop by. And we also know that when people isolate, that can create risk relative to mental health issues. And so if you know someone that is home that's self-isolating, this is still a good time to reach out to them. And we got all the great tools. I mean, whether you want to, FaceTime or Skype or check in or give a phone call, there's things that we can do to make sure that we're taking care of each other, but also reducing the potential spread. In closing, I want to thank the whole team that's up here. We've got a great group of folks that have been working, and thankfully they haven't been working around the clock every night. I know they were last night, but Mylin and Kirby and Tim and Christy and our entire Department of Health team and all the team members across the state of North Dakota who are working so closely with the federal partners, with the local partners, in terms of how we do that. And I would also just say on behalf of Lieutenant Governor Brent Sanford and myself, we have to say that at the federal level, whether it's the CDC, the Surgeon General, CMS, all of the Department of Human Services, and particularly the White House themselves. Vice President Pence, we've been on 2 phone calls with him. He's given out his direct contact phone number to all the governors in the United States, and I know that he has been directly working to try to resolve situations for North Dakotans, including North Dakotans that were caught on the Grand Princess cruise. And so we're so pleased with the support that we're getting at the federal level, and particularly out of the White House, where they're being incredibly responsive and putting all kinds of resources forward. And as you know, we just approved on Tuesday the approval of nearly $6 million at the Emergency Commission meeting. Some of you were there, but the federal government approved $8.3 billion in record time, passed both houses, signed by President Trump, of additional resources that could be used by the states, and nearly $6 million of that could be eligible to come here to North Dakota, and the team is working to make sure that we can receive that and deploy that in a way that makes lots of sense. So in closing, I do want to just say that, again, We're going to continue to work with all the state and local leaders, and whether those are educational institutions, faith-based businesses. We've had statewide phone calls with all of those groups earlier this week. We need to continue to coordinate again with the private sector, nonprofit leaders. At the state, we're taking a whole of government approach that we're doing. But again, in the end of the day, it's going to be individual actions of our citizens that will help slow the spread as much as anything that we can do as a government, as often is the case. Individual responsibility, back to those basics of making sure that in terms of how you're taking care of yourself and your family and playing your role in helping prevent and mitigating the spread of this. And again, we ask everyone, focus on facts. Not on fear. Be prepared as we are, and let's avoid the panic that we maybe have seen in other places, because we know that as North Dakotans we can pull together and get through all this. We're responsible not only for protecting ourselves, but also those around us that are most vulnerable. And I would ask again people to step up and help support. If you've got skilled nursing facilities in your community, that's our area of primary focus that we're going to go on forward, because again we want to protect those that are most vulnerable. We're going to have some other speakers here this morning, and then we'll do Q&A. Again, thanks to the media for being here, and thanks for your important role as we work through this emergency. And next up, we'll introduce our leader for the Department of Health, who's been a fantastic job, Mylan Tufte. Mylan.
Thank you, Governor Burgum. It's always hard to follow Governor Burgum because you can see his leadership is superior, and his support for the work that we're doing at the Department of Health and across the state is amazing, and we really appreciate that. I wanted to also thank the state agency partners that have come together and have been preparing for this day that we knew was coming. Thank you to our healthcare providers and the community health leaders that we have been talking with as we prepared for this day that we knew would come, but we are ready for it. So I'm especially thankful for public health's leadership and the role that they've played. We've also seen our tribal leaders step up and take serious measures to limit travel and protect their citizens. At the North Dakota Department of Health, we've been looking at the facts, taking them into account so that we can make recommendations that are aligned with the guidance that we're seeing at the federal level. This includes talking with our businesses, our faith-based organizations, our K-12 and higher education universities, and all of the, especially also corrections and rehabilitation. As the governor said, this is a whole of government approach. We're taking a statewide approach and how we prepare for this, and we want everyone to play their part. Everyone has a role to play. At Team North Dakota, we talk about leadership everywhere, and that applies for us, that anyone could be a leader wherever they are. And for you, wherever you are in the state, you have a role to play. You can be a leader. You can help us get the facts out, prevent illness, stop panic around this illness. We can do it. If anyone can do it, the state of North Dakota can do it. So I also wanted to say this morning we're going to be sending a memo to our long-term care facilities. We have been in talks with them. We want to help support them in every way we can. We will be recommending that they follow the national guidelines from the American Healthcare Association to limit visitors. And I know this is hard. You want to be in the facility where your family member is. But right now, in order to protect them and to protect yourself, we're asking these facilities to limit visitors to only essential visits, visits that may be around end of life or very critical situations. So I ask for your patience, and I ask for your grace to these facilities, that they're doing their best to protect the people that are there, not only their patients, but their healthcare workers. We know in North Dakota there is a shortage for healthcare workers. There's a shortage for nurses, nursing assistants, and we need to do everything that we can to support and protect these individuals. So with that, I want to just say thank you for everything that you're doing, and I'm going to let Kirby Kruger, our Section Chief for Medical Services, give an update, epidemiological update on COVID-19. Thank you.
Thank you, Mylan. So, as the governor has already mentioned, this is our first case to be diagnosed in North Dakota, and this individual did have a history of travel during the incubation period, and that's an important aspect of this investigation. And as we know, because what we're trying to do is figure out, did the individual acquire this his infection locally, or is there another probable source for that? And so knowing that the individual traveled and likely was infected while traveling, that means that we're not really looking at community transmission for this particular case. He is self-isolating at home, and he is recovering at home. His illness was on the mild side. But this is an emerging situation, and in the world now we've had over 118,000 cases. I think what's interesting in the world is when you look at the epidemiology of this, what's happening. We used to look at, this is a problem just in one part of Asia. It's not a problem just in one part of Asia. What's happening in that part of Asia is that the number of cases has plateaued, and what's happening in the rest of the world is that we're seeing dramatic increases in the number of cases. And so there's been a shift in the epidemiology of this since it started. In the U.S. this morning, when I looked at the CDC website, we have 938 cases in the United States, 29 deaths, and at least 39 cases reporting. Ours wasn't on there yet, so we know that there's at least 40 cases now. In North Dakota, we continue to monitor 7 people who have returned from travel, and that means that 26 individuals have been monitored in total, or are in the monitoring process. Laboratory testing is ongoing, and providers continue to call for consults. We have tested 27 people, as the governor said, and so those tests will come in on a daily basis. We don't expect that testing is going to slow down. And as the governor mentioned, and I can't emphasize it enough, and so I'm going to repeat it, is that there are things that people can do to help protect themselves and their communities. This is really a community thing as well. And top on my list is, if you're sick, please stay home. That's where you need to be until you recover. And so those are all important things. We heard these things over and over again. Avoid people who are sick. Wash your hands frequently with soap and water. Use a hand sanitizer that has a high volume of alcohol in it. Avoid touching your face with your hands. The good respiratory etiquette. If you don't have a tissue, sneeze into your elbow. If you have a tissue, throw it away when you're done sneezing or coughing into it, and wash your hands. And then heeding the CDC and State Department travel advisories and warnings as they change rapidly. And so it's important that you're keeping yourself up to date with those things. And people and families need to continue to prepare for this as well. And I talked about this earlier. Families and individuals need to now identify what their support networks are. Who are their friends and other family members that they can rely on to help them out if they are having to self-isolate at home or stay at home because they've been exposed. So people need to be able to also care for individuals at home. We know that the vast majority of people are going to have mild illness that will not require hospitalization, and these individuals can be cared for at home, but it needs to be done and correctly so that you reduce the risk for the others in the household. So, and then if you're notified by the state health department or another health official that you have been exposed to COVID-19, you need to be prepared to be at home for 14 days. And that's important because that's part of what we're trying to do in containing this virus early on, is that not only those individuals who are ill, but those people who are at highest risk, meaning they've been exposed to somebody, need to be prepared to be at home. And then preparing for schools and school closure or child care closure is also going to be important, and the impact that has on being able to go to work or if other work arrangements can be made, that type of thing. So we are continuing to ask people coming from international locations, returning home from international locations, to take a survey on our website. And when they take that survey, they do receive information on what they should be doing to monitor themselves or to practice social distancing, depending on where they're coming from, and what symptoms to be looking for. And that's an important part of it, because we really do want these individuals to try to either separate themselves from other people as much as they can, or to avoid those congregate settings. And that's important for what we're doing here as well. So the other thing that the governor mentioned that I really want to highlight is that most people are going to have milder illness, and they usually will not need to seek health care if the symptoms are really mild. Now, if they become more severe, obviously we want individuals to call their provider and talk about the need to be evaluated by their healthcare provider. But it's important that they call ahead. I think one of the biggest messages we get from the healthcare community is that people are still just showing up, and so it's important that individuals who have respiratory illness, any respiratory symptoms, who are seeking care, make that phone call so that your providers can prepare to handle you in the safest way possible. So. We also know that individuals who are older and who have chronic health conditions such as kidney disease, lung disease, diabetes, that type of thing, they are at higher risk for severe outcomes. And so we do have some recommendations for those individuals as well. And we encourage them right now to reconsider any cruises that they may have planned or may be planning, or reconsider air travel, especially if they're going to be long distance air travel. If possible, they should start avoiding or thinking about going into large congregate settings. And then if they know there are people that are ill, obviously to stay away from those and keep their distance from ill people. So our public health actions are multi-focused. It may seem like it's black and white. We are in a period right now where we still want to identify and contain, but there is no black and white line between these things. So we are also looking at the things that the community can do at the same time in implementing certain measures, such as all the things we talked about with the social distancing and that type of thing, and people taking care of themselves and washing their hands. All of that, there's no gray line. It all works together. There are right now we can emphasize, and we still are working on identification and containment, but eventually somewhere down the line we move to different measures that are more community based. So the last thing I really wanted to mention is this is a rapidly evolving situation, and it's really important that communities need to be prepared and to take action, because it is evolving so rapidly. Some things may happen on short notice, and so that is important. I do want to talk just a little bit about laboratory testing before I move on. As you know, our public health laboratory has been validated to run the test, and so generally the process works where if a provider feels somebody needs to be evaluated for COVID-19 or the virus that causes it, there's a consultation with an epidemiologist, and then we make arrangements to get that individual tested, and it comes in the laboratory. When the specimen comes in, then we can run the test. So there are several commercial laboratories on the private side that have begun testing. They have developed their own test, and this is something that us as a government entity, we don't control them. But there are testing that is available. But from what we hear through our national organizations that we work with at the laboratory level, is that they are overwhelmed as well. And so testing is sort of a limiting factor in the United States from several perspectives. Although more private labs are trying to get geared up for this, and we're hoping that this situation will improve in the near future. As we mentioned earlier, this is a presumptive case, and so we do send down to CDC for confirmation, and the timeline for that is really unknown, as it depends on the burden on the CDC lab. But our test results at our lab, once we get a specimen, usually we can turn around a result in about 24 hours, but it all depends really on collection time, transport time, and the location where the person is being tested. So those are my comments, and I would turn it over to whoever is next. Tim, do you want to make some comments?
Well, thank you for the opportunity. I'm Tim Wiedrich of the State Health Department. We've had a substantial amount of PPE that lies in a state medical cache. We have begun over the last 4 weeks or so, been distributing portions of that. We still have in excess of a million N95 masks, which seems to be the area where the most acute shortage is being felt for public health and medical providers. And so there have been a number of steps that have been taken to make sure that the medical system, including the specific materials, are appropriately stockpiled within our state. Well, there's so much more that we could be talking about, but I think that we're probably close to the question and answer period at this point. And so in terms of moderation, so let me go ahead and open the floor now to see what questions or comments you may have. Members of the press, if you would please speak up at the time that you're asking your question as loudly as you can. We do have a microphone at the front, but I also will repeat the question just to make sure that everyone can in fact hear.
So I have a question about the first case. Can you say where and when the man traveled?
So the question is about the first case: where and when did the man travel? Kirby?
So the individual did travel out of state. They traveled out to the East Coast, and that's as specific as I'm going to get right now. But they did travel to an area where there is transmission in cases that have been identified. So he traveled in March here. So.
You've all talked about the community's role in preventing the spread of this disease. There are some events happening this weekend, for example, state basketball tournaments. Is there any concern or direction from your offices on what the community should do to possibly avoid crowds in those situations?
Oh, yes. Okay. So the question is, we talk about the community role in preventing spread, and there are a lot of sporting events going on this weekend, and so there are some things in some guidance that we sent out, and we have been in frequent contact with the North Dakota High School Activities Association, and they issued a statement as well, but they are doing things that I think are really appropriate for where we're at in North Dakota. They're making sure that their bathrooms are equipped with the soap, and so people can wash their hands thoroughly. If the venue has access to hand sanitizer, they're going to make that available. They are encouraging individuals who may be at high risk to maybe enjoy their sporting events on TV, and then so those are some of the things that are important. And encouraging, of course, people to watch at home if they are sick. So they are doing and taking some proactive steps, I think. At this point in time, we'll just continue to be in dialogue with them because, as we mentioned earlier, this is a rapidly evolving situation. So.
You mentioned that the public health lab is managing the tests. So is this available throughout the state, or would people, if they contracted in a rural area, have to travel to Bismarck to get tested?
So in order to be tested, and the question is the testing available throughout the state? And the short answer is yes. However, it is considered an invasive specimen. There's specimen collection procedure when you put a swab through somebody's nose, and so a provider has to do that, and so they do need to seek care to get that specimen collected, and it's important for them to be evaluated by a provider if they think they have this, and so that's an important part of this. So
Maybe you want to clarify. Collection takes place statewide, but the analysis occurs.
right, yes, okay,
Hospital could handle
yes, 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 any
Similar to like getting a
right,
flu. It would be
yes,
similar to like getting, if you went in and said, hey, I don't feel well, then they might test you for influenza A. They take a swab. They have to send it to a lab. In this case, the only lab right now that can confirm the coronavirus is state lab. So if it was collected at another location and then sent here, then that's when the state would do it. State would confirm it or not.
What is the state lab's capacity to test right now?
so. And that's the $1,000,000 question. In that testing supplies in the United States as a whole are limited. We are working on right now. We are working on different methods to do testing, and so once we get those validated, our testing capacity will increase. But right now, it's fairly limited with the methods that we have available to us. So.
Right now is eligible for testing.
So the testing criteria is we did loosen it up a little bit from a couple weeks ago, and the testing criteria continues to be based on risk, travel history, or exposure to somebody who has COVID-19. It continues to be based on symptom severity. Those people that have severe illness, but we don't understand what's causing that severe respiratory illness. In other words, influenza has been ruled out, or respiratory syncytial virus has been ruled out, those types of things. And then it's also, we take into consideration, is the person in a vulnerable population or at high risk for an outcome, or does the person work with individuals who are at a high risk for a severe outcome? Those are all things that we take into consideration when we do testing.
In North Dakota right now, is the state lab able to meet it?
Our current demands, we are able to meet those demands. As this ramps up, though, it's possible that we will become more limited in our supplies. So, yeah.
To secure millions of dollars in federal funds for the state's response, is there a plan on how that would be spent so far?
We have developed a plan, and basically there are several areas that will be addressed by the funding. Obviously, that planning is ongoing as the circumstances continue to evolve, but there will be substantial investments in diagnostic capability. There will be investments in personal protection equipment for the medical providers, and there will be an investment in staff time as well. There are other ancillary portions of that as well, but that will consume the majority of the funding that we believe will be available to us.